everyone, and welcome back to our weekly Sunday 9 p.m. live video. Okay, very happy new year to all of you, and for those who have celebrated Christmas, Merry Christmas to all of you. Today our topic is again requested by one of you. Okay, the question was very simple. She said, what are your advice for women who are in their 40s and still single? So for all of you, any of you who are in your 40s and still single, do stay tuned, yeah? 40s single, I think there are two possible group of women. One are, they are still thinking of maybe one day they won't be single, or the other group will maybe eventually forever be single. So there's slight difference between them, because one, fertility is not a concern, but to the other group, fertility is a concern. Okay, before I go into fertility, what is so special about women who are in their 40s and still single? One thing I have mentioned a couple of times in some of my previous videos, that is, women is very interesting in the sense that our uterus is meant for childbirth. The very sole reason why women have uteruses is just to reproduce. The very main reason why women have ovaries is to reproduce. So when you do not reproduce, that means you're single and you do not bear children, somehow there are more problems. We know by research and statistics that women who are single are more likely to have uterus cancer, breast cancer, ovarian cancer, uterine fibroid, endometriosis, polyp, you name it. That's why previously I used to say, women, if you don't grow a baby in you, your uterus will grow something else. So that is why women who are single all the way up to their 40s and have not bear any children. That applies even for women who are not single, who are married, who have children already. Because nowadays, even if we have children, maybe we have 2, 3, we no longer have like 10, 20 children like women in the past. So it is still the same. Too long a period, if your uterus do not grow babies, it will grow something else. So if you are single, definitely your risk is even higher if you have never had a single child all your life. Because all your life, your uterus have not even grown a single baby. So your chance of growing something else in your uterus is higher than the general population of women. So what are the things that you need to take care? Number one, you need to visit your gynae regularly. You see, the thing is, a lot of married women with children, they tend to, know that, oh, after I give birth, every year I must go and see my gynae, I must do my pap smear, they have these regular practices. But for women who are single, without children, they don't usually go and see a gynae. And that is why we are very worried, because they don't come and see us, but they are at the highest risk of all kinds of problems. So first thing, you need to see a gynae even if you are single. Some of you would think that, I'm single, I've not had sex before, I can't do pap smear. I heard that pap smear is only for women who have had sex before. Oh, I'm so scared, I don't want to go and see a gynae. But that's not true, because when you come and see a gynae, and if you say that you are single, never had sex all your life, we are not going to force a pap smear on you, no. But we will do the rest of the tests that you need to do. Because we all know you're at risk of breast cancer, uterus cancer, ovarian cancer. So we will still examine you to make sure you have none of all these problems, which means that we examine your breast, we do a mammogram for you, we do breast ultrasound for you, we scan your uterus, your ovary, to make sure everything is normal. Alright, so let's say if you are not the type that will go and see the gynae every year, or maybe you do go and see gynae, but not always, maybe you forgot, or maybe very common MCO, a lot of people forgot to see gynae for 2 whole years, until recently I've been seeing a lot of women who come to see me have not come and see me for like 2 years already. So in between, when you delay your pap smear, delay going to see a gynae, what do you need to look up? Okay, women problem, quite straightforward, is always 2 problems only. 2, I'm not going to talk too much about breasts first, I'm going to focus on the uterus. Uterus only have 2 symptoms that you need to watch out for. One is the bleeding, another is the pain. So if your menses is normal, once a month, the flow is normal, everything is still normal, maybe you're still okay, not to worry too much. But if you have heavy menstrual bleeding, prolonged menstrual bleeding, or intermenstrual bleeding, so these are the 3 things. Heavy menstrual bleeding, that means you notice your blood flow is heavy. When you see your blood flow heavy, 1 month, 2 months, you better go and see gynae. Don't wait 6 months, 12 months here. That is what I usually see. 6 months, 12 months. Oh my God, why 6 months, 12 months? You see, the thing about women when they're in their 40s, whenever they have this heavy menstrual bleeding or prolonged menstrual bleeding or any abnormal menstrual bleeding, they always like to blame it on, maybe I'm going to menopause already. I heard that before menopause, the bleeding becomes abnormal. Then they don't come and see gynae until they think something is not quite right, which is kind of dangerous. Because you must understand, if you're single or you have not had any children for a long, long time already, your risk of growing things in your uterus is very high. So you don't wait. If you have abnormal menses for 1 month or 2 months, the most 2 months, you must go and see a gynae. Let the gynae check you first. If the gynae says, I think everything is fine with you, you're most likely going to menopause, that's fine. The gynae say you're going to menopause, that's why you're having the abnormal bleeding, not the other way around. Yeah? You don't like, I think, no, I'm going to menopause, that's why I'm like that. Oh no, you don't presume that way. Yeah, you don't presume. Unless the gynae tell you that, I think you're going to menopause, everything I check is normal, and then you're normal. If not, it may not be normal. Heavy menstrual bleeding, heavy means you can see the flow is heavier than before, which is very, very abnormal for women in their 40s, because we say that when you reach your 40s, your hormone actually get less and less strong. So what actually happens is you're supposed to get less and less menses, not more and more menses. So when you have heavier and heavier menses, you have to worry about something wrong with your uterus. You have to. So that's the first thing. You have to think about possibility of some problem in your uterus. Number 2, prolonged menstrual bleeding. That means normally your menses is 5 days, 7 days, or now it's 9 days, 10 days, 14 days. Oh, you must go and see a gynae. You must go and see a gynae. Something is not right. Or third, intermenstrual bleeding. You already had your menses just over, not long. And why you bleed again? Something is not right. Why you bleed again? This is intermenstrual bleeding. And when you have that, you must go and see your gynae. So any form of abnormal menstrual bleeding. There's one more where your menses came, but so little, like never come out at all. It's so little. That is also abnormal menstrual bleeding. Abnormal menstrual bleeding can be due to fibroids, adenomyosis, endometrial polyp, uterus cancer. So there are many reasons why a person have abnormal uterus bleeding. So if you have abnormal menstrual bleeding, please see a gynae. At the most, if it happens twice, you must see a gynae. Okay, the second symptom that you watch out for is pain. If you have followed my videos enough, you will know that I always say there's no such thing as menstrual pain. If you have menstrual pain in your 40s, every month you have to take MC. Every month you don't take MC, but you need to pop painkiller. Every month you have menstrual pain. Maybe not too bad. After work, you must rest. You must take a nap. That's not normal, yeah. Women in their 40s do not have menstrual pain. If you have menstrual pain, we need to think about endometriosis, fibroids. We need to think about problems like ovarian cysts. And other than menstrual pain, what if you get pain at funny time? You get your pain before your menses every month. You get your pain after your menses every month. You get your pain during the ovulation period every month. All these are not normal. There are signs or possibility of endometriosis. So you need to see your gynae. So these are the 2 symptoms that you need to watch out. 2 main things that you need to watch out if you're in your 40s. Because as I say, if you're in your 40s and you're still single, your chances of having any of the gynae problem is much higher than everyone else. Next, we want to talk about fertility. We still need to talk about fertility because not everyone who is single in their 40s will think that they will be single forever. So, if you are single, but you may still think maybe one day Mr. Right comes along and I'm no longer single. So every woman, even though they're single, they do think about maybe you need to get pregnant or you want to get pregnant one day. Can you get pregnant in your 40s? In the 40s, you see, there's a difference between women today and women like 100 years ago or 50 years ago. You will see a lot of our parents, especially if your parents have like 5 kids, 10 kids, you'll see they give birth, 40 something still give birth, you know. But if you see women today, a lot of them, when they're in their 40s, you will notice one thing. Many people find it difficult to get pregnant. Why women today in their 40s difficult to get pregnant, whereas women in the past, in the 40s, just go on giving birth? One of the reasons is, as I mentioned earlier, your uterus may not be so healthy anymore. Because when you have no children previously, high chance you may have something else. you have endometriosis, you have fibroids, you have polyps, then your chances of getting pregnant will be much less. So another issue about 40s. When we talk about 40s, we talk about quality of eggs. The quality of egg may not be so good anymore. So number one, more difficult to get pregnant. Number two, higher chance of miscarriage. And number three, higher chance of abnormal baby. So when women come to me in their 40s and sometimes they may be single, but finally maybe they're thinking they're going to settle down, or they're already married and they're thinking of getting a baby. Whenever they ask me, now at this age, doctor, do you think I am suitable to get pregnant? Then normally my answer is very simple. If you can get pregnant, go ahead, but I have a long but. What but? When you get pregnant at this age, you must be mentally prepared to face some complications. There are just more complications for women in their 40s when they get pregnant. More miscarriages, more abnormal baby, more diabetes, more hypertension, more heart problem, more severe bleeding after birth, more difficult labor, more cesarean birth. There's just more and more of everything that you can name off in obstetrics. So you need to be prepared. You can. No harm. I have my oldest patient is 55 years old when she got pregnant the first time. And guess what? She's single. She just decided to go and get some donor IVF and she got pregnant. Is there anything you can do to prevent this? Because you're 40 and you're single, but you don't know, maybe one day you still want to get pregnant if somebody, Mr. Right, comes along. Is there anything you can do? Oh yes, freeze your eggs now. In fact, it's better to freeze your egg in your 30s and not in your 40s. But if you reach 40 and you're still single and you may think one day, if Mr. Right comes along, I want to get pregnant, then you better freeze your egg fast. Okay, but if you are in your 30s and there's still no Mr. Right and you're still waiting for your Mr. Right, you can freeze your egg even in your 30s, even better. The younger you freeze your egg, the quality of eggs are even better. So freezing egg is something that every single woman who have not had children, either by mid-30s or late 30s, or even in your 40s, you must consider freezing your eggs. Keep your eggs. Who knows? The Mr. Right may come when you're 50, but your eggs you kept, you can still have babies, okay? With IVF, test tube baby technology today, freezing egg is possible, and we seriously encourage women to do that because we see a lot of women who only get married or found the Mr. Right guy maybe only in their 40s or even 50s. Like today I met one. Every year she come and see me for her gynae check. And she's single. Single, not sexually active, never had sex before, virgin. Those days she was like that. Today she come and tell me she's 48 and she finally found Mr. Right. The right guy came along at 48. You can always still have a baby at 48, there's no harm. But the quality of the egg becomes a problem. And that is why this is one thing you need to seriously think about. If you think that if the right person come along, you may still want to have baby, then you can start freezing your eggs. Just go to any of the IVF centers and say, I want to freeze my egg. Another thing, other than the uterus, fertility, last of all, of course, is your breast. Same thing, breast is the same as the uterus and the ovaries. You don't use it, it's going to grow something else. So originally, the sole function of a female breast is to breastfeed. Is to breastfeed your babies. So if you do not breastfeed your babies, naturally, your risk of breast cancer goes up. And so, when you reach your 40, you need to see a gynae or a breast surgeon or just any health center, get a routine mammogram and ultrasound breast. So these are the things you need to do. So if you're single at 40, never had any children before, you may not be single, but you never had any children before. Or you're already married and you have kids, but you've not been having children for a long time already. So that is when your risk of all these problems go up. So you need to get gynae check every year. You need to do your breast ultrasound every year, mammogram 2 years once. And if you're thinking of maybe you may want to get pregnant one day, then you need to freeze your egg as fast as possible. Fast, go and freeze your eggs before it's too late. That's a very good question. And in fact, I've mentioned it in my video before. Women, if you do not grow a baby, you will grow something else, grow fibroids and endometriosis and things like that. To prevent your uterus from growing all these things, the only way is to make your uterus the type of uterus that cannot get pregnant. So that is why you need to be on birth control. But the problem is, if you're single, how many single women will go on birth control pill? In Malaysia, I think it's a very, very difficult thing to find. Even if you tell them that it's good for them, very, very few Malaysian or Asian women will actually go on birth control pill just to prevent fibroids and endometriosis and uterus cancer and polyps and ovarian cancer. You see, just on birth control pill can prevent all these things. But if you're single, would you do it? I would encourage you to do it, and I think that is really good. But unfortunately, our culture, still there'll be a lot of taboo. They are both equally important. Mammogram can miss certain things, ultrasound can miss certain things. And you don't want to miss anything. Because breast cancer, there's just so many types and so many scenarios. Not all breast cancer can be detected on mammogram, and not all breast cancer can be detected on ultrasound either. So you actually need both. Alright? Actually, you are asking all these breast cancer question. I know, I have to confess, I've not done any breast cancer video, okay? Partly is because I'm a gynae. Gynae, we are not supposed to do breast cancer. We are only doing uterus and ovary only. Many of us do check the breast, but any problem, we will send them to someone else. We send them to the breast surgeon. So it's not under gynae. That's why I never talk about breast. But I am thinking one day maybe I'll talk about breast. I will get a breast surgeon to talk about breast, okay? There are so many breast surgeons around. If I can get one and grab one, and maybe we can have a session one day. I will keep all your breast cancer questions in my question bank, and one day when the time is right, when I can get someone, I'll probably do one, okay? There is no vaccine to avoid uterus cancer. The only vaccine that is available for gynae cancer is for cervical cancer. And you notice I didn't mention anything about cervical cancer today, because cervical cancer is linked to sexual intercourse. Of course, I'm not saying that single women do not have sex. Maybe they do have sex. Then, of course, their risk of cervical cancer will be there. But their risk of cervical cancer is not higher because they're single. No. Because cervical cancer is higher. It's not higher whether you're single or married. It comes with sexual intercourse. Sexual intercourse gives you infection, gives you cervical cancer. That's why we give you vaccine. We give you vaccine to prevent the infection. Uterus cancer is not due to infection. Uterus cancer is not due to infection. And you want to know more about cervical cancer, about uterus cancer, I have these videos all in my YouTube channel. Please go to my YouTube channel to watch all my old videos on cervical cancer and uterus cancer, and you will understand. So there is no vaccine for uterus cancer. Yes, it's licensed until 45. It's licensed until 45. It's licensed from 9 to 45. So 40 years old, yes, you can still go and take your vaccine. And in fact, if you are 40 and you're single and you never had sexual intercourse before, it may be good to take your vaccine now before you start having sexual intercourse. That would be better prevention for your cervical cancer. All right? Yeah, for those of you who have not seen my other videos, I noticed because you asked a lot of questions about cervical cancer, uterus cancer. They're all there, in my YouTube channel. Go to my YouTube channel, yeah? Dr. Tan City Clinic. Please subscribe and like my videos, yeah? Okay, so go to my YouTube videos. Go and watch my YouTube videos, they're all there. If you go to the playlist, you can look for gynae cancer, and then under cancer, you will see all the cancers there, and then just go through every video, you'll know. Every cancer comes for a reason, and every cancer is preventable. So you must know how to prevent your cancer. If you know how to prevent, then cancer don't come lah. And then all cancers, especially gynae cancer. Gynae cancer is like, I think almost all gynae cancer are preventable. The problem is we never prevent cancer in us. We just let it be. Go and watch my video, you'll know. All of you, I would say a majority, especially women in Malaysia or Asian women, they don't actually prevent cancer. They just let the cancer come. Because the things that you will go to see, what I tell you, how to prevent cancer, gynae cancer, is all preventable. But the thing you need to do may be something you're not willing to do, and that is the biggest problem in Asian women. Okay, so yeah, it's a bigger problem in Asian women. Yep. And so that's all for our video today. So stay tuned again next week, same day, same time. Bye bye.